diagnosed with lung cancer should have this procedure for staging purposes. There are certain other scans like PET scan which help in staging also, but they are not the most accurate. EBUS has better results than PET scan for lung cancer staging. So this is our EBUS machine, and there is another tower next to it into which all the bronchoscope attachments will go, but this is the main EBUS machine. That's what we purchased last year and we started doing this procedure. So I'll show you the EBUS scope. It's very similar to a regular bronchoscope, a little bit thicker maybe than that, and it has an ultrasound probe at its tip. That's the difference in this one. And with that ultrasound probe, we can see the lymph nodes. There are many lymph nodes. Let me show you where they are. So this is a diagram of the various lymph nodes. This is our right lung, this is the left lung. So all these green dots are the lymph nodes between the two lungs. So that's what we try to sample when we do EBUS. So we give them different numbers, like we call it station 2R for the right side, station 2L for the left side. Station 7 is common for the both right and left, whereas all others will have a right and a left. So our bronchoscope goes in through the ET tube since the patient is intubated for the procedure, and the bronchoscope reaches into this windpipe, and in the windpipe we put on the ultrasound and we get images. This is the ultrasound image what we see on the screen, and then we see these are the lymph nodes marked as LN, and then these are blood vessels around. So with the ultrasound now we can see where our needle is going and make sure the needle is not going into a blood vessel but rather going into the lymph node, and that's how we get more accurate biopsies as compared to a traditional bronchoscopy where we did not have any of this and we were just passing the needle blindly and hoping that we are hitting the lymph nodes. This is very, very useful. It's a big plus for the oncology lung cancer patients. If they are diagnosed with lung cancer, earlier they used to undergo a procedure called mediastinoscopy, which is a surgical procedure, whereas this is a non-surgical procedure, and in fact it has better results than the mediastinoscopy. So it helps in staging of the lung cancer. What stage of lung cancer does a patient have? At our institution, we have the pathologist with us during the procedure. He keeps looking at the slides as we are doing the procedure, and he lets us know, are we getting a good specimen or not? If not, we try to go in and get more specimens. It's just like a day procedure. Many people get colonoscopy, it's a day procedure. It's a little bit more than colonoscopy because these procedures sometimes can last up to an hour or over that. So we have anesthesia with us, and we in our institution intubate the patients for this procedure. Previously it used to be if a patient has a lung mass, they would get a biopsy either by a bronchoscopy or by a radiologist under a CT guidance, and then they would undergo mediastinoscopy or EBUS in outside places. So it used to be a two-step procedure, but now we can all do that one together. If there is a lung mass, yes, we can do the biopsy and do the sampling for staging at the same time.